Okay, coming up next is one of our most awaited sessions of the day. It's the AI workshop. We all know how pervasive AI has become in our lives, and the medical field is no difference. So, we are bringing together four specialists who operate at the intersection of medicine and AI. And they are here today. Dr. Pradeep Kumar TJ, consultant physician and diabetologist at Medicover Hospital and Brookfield Hospital, Bengaluru. Dr. Alok Modi, consultant physician and diabetologist at Dr. Modi's Diabetes Center and Kevalia Hospital, Thane. Dr. Hem Kumar TR, consultant physician and diabetologist at Kaveri Hospital, Bengaluru, and EC member of KRSSDI. Dr. Praveen Gangadhara, consultant physician and diabetologist at Dr. Mohan's Diabetes Care Center, Bengaluru. Sirs, over to you.
Thank you, Dr. Pradeep, for your very crisp and clear um, guidance. So my talk is little jumble. So I wanted to actually demonstrate making an agentic AI, but I miserably failed in doing that because I consumed all the tokens, so I got stuck half the way through. It takes 1.5 to 2 hours to create a simple agent. But I would like to go little farther than what Dr. Pradeep has told. Um, Whatever he has told is a generative AI tool. Whatever he has told is. So we type in a chat box, it gives us a output as a chat. So this is what is Chat GPT is, and generative AI is. So this is the basic of AI. We can say that Chat GPT or whatever generative AI we are talking about, Gemini. So these are all the AIs where it is like a probably a receptionist or a librarian or just a wise person sitting next to you. So you ask a question, they just answer you. So they are not going to do any task for you in a repeated manner or in a specific manner what you ask for. So you can ask Dr. Pradeep, Dr. Pradeep, which one I should use, Chat GPT. He will say whether Chat GPT or Gemini. That's all. So he is not going to use that for me and then get back to me. And he's not going to generate something without my inputs or prompts. So we can go one step further. So actually there are specialized firms which are creating AI-based tools, EMRs, research assistants, and many more things. But there are some small things. Me being doctors, we are all little curious whether we can do it on our own. Shall we try it on our own? So I'm going to just talk few slides about those tools which I have been using in various forms. So I have been using it in the my clinical practice also, and also in the um, my day-to-day life. I have been using that. So I'll just go through that. So couple of things is uh, when I use when I am just biased towards Gemini because I have been invested too much into the Google ecosystem, and so I got 20,000 worth of subscription. I have done that. So I keep on trying things whether I can improvise myself. So some of the small things what I have done in the recent past using the um, Gemini. So yes, if you have any of you have a tab or a phone or a computer, you can see this in the side. There are quite a few things there. New chat, search chats. This new chat or search chat is nothing but the generative AI what we are talking about. If you go below, this is image generation, this is video generation, and library where this thing is. Next two are the things which are very important. What I am talking about. One is GEMS, another one is Notebook. So Google did a excellent job of adding the Notebook LLM in its single panel. It was a separate software, separate toolkit was there earlier. So now they have integrated it into the Gemini single workflow here. They have done that. I will be keep on telling about some words of like workflow. So workflow is nothing but how you do it a process by step. So for example, a clinic, a patient comes, a receptionist registers a patient, then we take the history, then we examine the patient, then we decide what to treat them with and give a prescription. So this is what is a workflow is. So whether this can be automated, whether this is a repetitive task. In this, except for clinical decision making, most of the tasks are repetitive. So many of them can be automated in small levels, micro levels, which can be done. I did that and it was reasonably good. So one of the places where I used was a discharge summary, vetting the discharge summary. So many of the times I have seen discharge summaries have lots of repetitive errors. So I have tried that, and then I have been reasonably successful in removing lots of grammatical errors, lots of the double medications, two medications in different forms, different brands being prescribed, a dosage wrong. So many of those errors I was able to um, weed it out. So that is what I have been doing with GEMS. I will and about the identifiable the demographic details uploading. So we have a option if we are subscribing the free versions. We don't have that option. If we are subscribed to a version, so we can actually switch off the learning mode in those options. So first I'll go through the slide set. I have not done much in that slide set. One moment. So I have to use a different account now because of the problem I faced yesterday. So beyond, this is the actual topic I have been thinking about. So beyond generative AI, a short peek into the assistant and an agent. So we'll just go through which are all the types of assistant, which is the agent, what is an agentic AI and what is the difference between the agent, where we can slightly use them. And a couple of examples I have, not directly with a clinical application, but more of a general application. So we can improvise on that going forward. So I'm a learner. I'm certainly not an expert. Probably there are three of the experts are there in this talk. I'm the learner. I'm very curious about finding out things like this. And there are lots of nights I have spent in finding out and ending up in a wrong road and then coming back again, creating something new thing. So passive generation to active problem solving. So we have asked a question, as Dr. Pradeep has told, we have put a question to this. I want to, what is the prescription I should give? So it says that, okay, this is the prescription. So what if I give a prescription to that and tell us, so what is the problem with the prescription? Clarify what it is. So it is a problem solving. So I give a patient data again and again and again. So what happens? So in the generative AI, the problem is the hallucinations. So if you ask the question again and again, it starts going to give you different answers. But when we are going into assistance, so in the assistance, for example, you are getting a secretary for you, the hospital secretary, clinic secretary. So we are hiring a secretary. Then what happens? So any secretary who is walking into it, they can be well qualified. They can be probably a graduate, but their output is not going to be the same every time when you tell them a task. But what we do, we hire a secretary, we train them 3 months, 6 months down the line. They understand what we want to do, and they keep doing the same thing again and again. So our load decreases. That's what the AI assistants can do. So agentic AI is goal-oriented. It executes multi-step workflows. We have a nurse who goes and gives an injection. We have a receptionist who registers a patient. We have a physiotherapist who does the physiotherapy. We have a billing manager who goes and bills it. But all these things can be put into an agentic AI if we have a capability. So we can put it into an agentic AI and try to do that in a single workflow. That is possible. But it takes some time. And they operate autonomously and achieve complex objectives. When we complex objectives, when we say there could be two different outcomes for the same objective. There could be an error in the first objective what we have given to the AI. So the AI gives to us. Say for example, they may have prescribed a gliptin for a patient who is having GLP-1. But it is going to rework it up, clarify it, it will come back with a solution on its own. It's based on the workflow what we have created, the nodes what we create in that. So continuous agentic means it perceives, reasons and acts. It acts also. So for example, we can send a mail with a AI agent. It doesn't tell us what is the mail to be, but as again, once again, what we have seen is there is something called human in the loop. The final executive step, as of now, it's not possible directly with an AI, at least in the personal aspect. So we have to go the send. It drafts and saves the mail. So it looks little confused, but these two different things, agentic AI and agent. So agentic AI is nothing but the entire workflow of the organization. Agent is something what we are talking to. Somebody like, so this is the thing. So I have one disclaimer, I have created all these infographics with my inputs to Gemini. Through the Gemini notebook LLM and also using the Gemini gems, I have created these infographics. So we have James Bond, who is an agent. So who does the work actually? But MI6, the organization, is a agentic AI, which creates the protocols, what has to be done, where they have to do, and where the resources are. Everything is with the agentic AI. So the agent is somebody who is conversing or at the end part of the execution. In a chatbot, agent is a chatbot over there. So we are conversing. There is a railways now have a chatbot, or any mobile companies we go, there is a chatbot. So these are the agents, chat agents they are all. So but the execution happens with the agentic AI. That is the difference. So we have other part. So what I have spoken about is GEMS and the notebook LLM, which we are seeing in the Gemini, the work table itself. We are seeing the workspace itself. We are seeing Gemini, GEMS and notebook LLM. These two are more interesting to me than the agent probably. So because these two are very simple products, easily available in our in the Google, whatever, everybody has a Google Gmail account, so it is there available to us to work with that. So this has two different aspects. They are assistants, they are not agents. So what is the, again, one more different slide, which is a traditional app, autonomous agent. What is the Gemini Gem? See, we have apps. Again, whenever somebody is creating an app, some developer comes and creates an app, they would have used various aspects of the artificial intelligence, probably as a brain, to create those apps. That is again custom made with a single task in the mind. Again, when we make an AI agent, autonomous agent, that can be made with even a small skill set from our own computers, personal computers. So what I have showed the notebook LLM, and this thing is just like doing a CPR on the mannequin only. The real aspect goes in the real development of an app or an agentic AI, which are done by people who are really into that. Say, I think Dr. Alok has done that no-code AI program. So that goes into most of the things. The effort goes into understanding how do we develop an agent without writing a single line of code. So there are lots of tools available where you don't have to write a code, but you can develop an agent. So I'll go to the demonstration. So these are the three tools which I day-to-day use for creating an agent. Means I won't say day-to-day, but I have been trying to use them. So in this N8N is one which is very easy for me to understand and do that. I will just demonstrate what I have done in different aspects by notebook LLM or this thing, and where we can use this in clinical practice in smaller levels. So we can divide it into appointment making, calendar and appointment making. We can use that. So we can create a chat bot where you can, somebody sends an email or a message or WhatsApp message telling that I need an appointment. An AI agent can see our calendar when we are attending a conference, when we are going on a vacation, and it can reply to them telling the doctor is available on these dates, and it can even make an appointment and reply back. It is limited this thing. Triage and pre-consult. I think somebody was telling before also that triage and pre-consult can be done through the AI. So they give the demography, they give the history. So it is divided into something acute cases, chronic cases, what are all the aspects what we are looking at, a diabetic, a chronic problem, or a fever or some infectious disease which is an acute problem, that can be differentiated. Reception and queue management, this is always already we are using in many of the EMRs have inbuilt into that, and billing assist also we can do. Prescription is still not into the O. So human in the loop, again, once again I am saying we are legally responsible for whatever the AI does. We cannot say I generated it with Gemini, so I don't have a responsibility towards that. The last action of giving it, handing it over to the patient is with us only. So whatever happens to the patient, we are liable legally and technically we are liable to that. Thank you. And I'll go to the few demonstration what I wanted to show you. So GEMS is something which we have created, few of them. So now there is something called GEMS Labs is available where it is giving lots of templates where we can develop it. So this is a funny thing, means I have been using it six months. So this is a home teacher. So what I have done is I have uploaded my children's geography book, the pages. So those are all the pages. So I upload this and I develop a question booklet, a workbook. So lots of fill in the blanks, MCQs, match the following. The same thing we can do it for our own this thing. I will show what I have done for myself. This I use the Gemini GEMS. I just open it, I give a prompt telling that based on this you prepare a curriculum for my child who is a 7th grader. So give all these things. So this is for a simple gem. So the same thing I have used in a notebook. Notebook is slightly different. So gem and notebook, the primary difference what we can say is gem you give a single prompt and a single task and keep asking that, it will keep on doing that again and again. Say geography book can be replaced with a history book or a science book. I give a prompt that this is a 7th grader which has who wants to learn all these things, so we type it down. So I went to UK. So I rented a car. So what I did is I downloaded the UK rule book and put it into the notebook LLM and I made it do a so here in the notebook LLM we can actually develop so UK driving rule crash course. So if you see the right side tab, so you can develop an audio telling that all the rules to be listed into a single audio file. You can listen to that. And you can go to a slide deck. I can tell important rules to be made into a PowerPoint slide and I can see that. A video of all those things can be done. And mind map we can create. For me important is the flashcards and the quiz. I made a flashcard. So it keeps appearing in my phone whenever I open the phone. It appears as a flashcard. Important rules keep getting reminded to me. The quiz. So every day I'll form a quiz of 20 or 30 questions and I'll try to answer it. So whenever I'm wrong, I'll tell the notebook to create another flashcard reminding me that you are making it wrong. For example, there are quite funny rules in UK driving. So I reasonably mastered all those things, at least mentally. When I drove, it was miserable, but I did that. So same thing. So we can keep doing where the notebook LLM is good in is for our research. So if you are going to study about present about something, so we can download all the papers about that, publications, upload into a single notebook and develop PowerPoints, quiz and also the material. It can summarize it and give it to us and we keep reading it again and again. So for example, we can for diabetes mellitus, say gestational diabetes, we can download all the papers on gestational diabetes mellitus, upload it in the single notebook. You create a notebook, just like you are creating a notes in our college days. So we create a notebook where all the articles are compiled and then we go back and read the notes. We highlight something and read the notes. Same thing, sometimes we draw a diagram, sometimes we create notes, sometimes we ask questions, somebody else asks the questions from those notes. So same thing can be done in the notebook LLM. It's very simple to do. So we have to just go there, create a notebook and here you can see add sources. We can keep adding whatever sources, journals and newspaper reports we can keep adding. That will give us an output. Coming to the gems, it is very simple. If I'm not sure. I actually created a prescription generator using the gems. So all we have to give is the details, RX Smart, yeah. So it's like something like an agent I have created using the gems only, a mini agent. So we give patients demographics, we give the clinical data, and we give the physician notes, what I have examined and all those things, what I expect. This patient is that cannot afford a expensive drug. And also I have actually told the agent, prescribe only drugs from Sun Pharma or US, which means I'm just pulling out an example. So it can be from our hospital formulary. So these are all the drugs available in my formulary. Prescribe the drug only available in that. It gives a nice output. I write a prescription, I compare it with that and see whether I am right or the AI agent is right. So these are all the small applications we can do. Agentic AI, when I come to that, that's what I have miserably failed in demonstrating, but I will try once again. So this is a simple workflow how real agentic AI is created without any coding. So this is a very simple one. So AI agent workflow, here we see. So we can go here, create a workflow. So we see here 3 different aspects we will be seeing. So this is simple, we can build it with a. So for example, I have used the daily news agent as an example. So it has created a daily news agent. What it does is, I can give an interest of my, means whatever is my interest. Say for example, I am interested in Iran war. So, or I am interested in whatever happens in diabetes all over the world, any news coming about the diabetes. So it keeps, just I can write a prompt over there and give it, and it will take a task of building the agent. I have to give the brain. So usually it gives a OpenAI as a initial credits it gives, but I can connect the Gemini to that. As my subscription of Gemini, we can connect it to that. So it will create the entire, it will scroll through all the news sources and get whatever is the news relevant about diabetes, and gives an email summary of what all happened about diabetes in past 24 hours or 48 hours or 72 hours. We can do that. So it takes some time. That's why I told. So I took 45 minutes to create my workflow yesterday. So this is the example. We can keep adding the notes. So fetch AI news. So summarize the articles and then give an output. So each step can be customized by us in whichever way we want to, and create an workflow. So that's it to the agentic AI. Why it is again important to us is, so probably big enterprises will be able to afford to build big AI agent with lots of different applications. But even for small applications, sometimes we may have to do something on our own. We are going towards that scenario where sometimes we may not be afford to buy something custom-made software, paying lakhs of rupees or thousands of rupees every month subscription. It might be a simple task, so we may have to create the AI agent. This is what is the next thing which is going to happen. So either there are companies, big, huge corporates which are into this, and there are small people using the generative AI. We have to go to one step between those two corporates and ourselves. So we create custom agents, or at least the assistants, the Google Gemini Gems or Notebook LLM in our day-to-day practice. And probably many of us will be having much more ideas to take it forward and give lots of this thing, and we can publish this. So if you have seen the Gems window over there, it publishes. If somebody can create a gem, it can be published, and the Google takes it up and it creates this. These are all the recipe genie. I actually created something like this 6 months back in a very small fashion. Now I published it, I don't know, because of mine or maybe so many people were trying that. This recipe genie, what it does is, you take the photograph of whatever is left over in the fridge, it will give us a recipe, what you can do with that. We can say that South Indian, we can say North Indian, we can say continental, anything like that. So these are very interesting. Please start using these aspects. Don't keep only typing in ChatGPT and asking the questions and getting back the reply. That's what I would say. Thank you.
thank you, Kumar sir, for setting the tone, and thank you, Pradeep Kumar sir, for making my job easier. I'm also a learner, not the expert. The expert is yet to come. I'll give the hype later. Uh, but at the outset, thank Manohar sir and the entire Disha team for calling me up. I think last 2 years, I'm a little old school, so when you talk about PPTs in presentation, we have this habit of, thanks to our teachers, a proper review of literature, proper going through the slides, and the presentation is the last thing we think of. We kind of copy paste and we finish it off. But I know as much as one may have the skill to make this thing, it's very important you present it in a right way, and that is where these presentations and using the AI can definitely fine-tune your skills. As we keep telling, it's not like you replace human beings, but so we have a lot of tools here, and the things are evolving. What was good a couple of years back is different from what it is. I will not bore you with a boring slide presentation, and because of the shortage of time, I also thought I will show some demos, and I leave it to you people to choose which platform you can choose to make the presentations. How many of you, I think most of you do use, but how many of you use which is your favorite platform for making presentations? Just before we start no, I will ask the expert at the end. I'll ask my audience first, and then I'll come to the expert. Because experts, okay, so, right. Perfect. So I think everybody has if you look at the PPTs, most of the experts also will have a style and a stamp on it. And that is something which I always believe that we need to retain, irrespective we are using an AI or not using an AI there. But AI definitely helps in refining things. So we all know that, in fact, human brain processes, this is what the AI told me, it processes 60,000 times faster than the text. At most medical presentation remains walls of bulleted text. One thing which I really hate is too many things cluttered in a slide. And that is something which maybe you need to talk more, but your whatever you want to convey has to be pretty simple, and the audience should be able to comprehend that. I think the slide should be impactful, so it's important you have the audience trust. There should be faster comprehension. Obviously, try to make less error on the stage, and obviously, it should be a reusable asset. I think in many colleges they use PPTs like notes, but though we like to read the textbooks, there are a lot of people who refer the PPTs as a kind of notes there. But when you talk about the tools there, I think you have a lot of tools, and I think already Pradeep sir has already given a very good illustration that use everything. Like it's like making a chart, or it's like, I will not call it as Bisibele bath, but it's like making a chart. You need to use the right things in the right proportion. Each tool has its strength. So you still understand the basics of driving your car. So if you know your manual car and you know basic principles, then you move to an automatic car, you understand things. So similar way, what I mean to say is, your review of literature, your subject, I know you may go to Google, search the articles, you may do that. So you have a tool which again refines your literature search, which can make things easy for you. You understand, I know everybody is good in prompting. You cannot go with a generic prompts when you make a PPTs. It's not like your Google questions which you try to ask. Kindly make a PPT or a 20-slide PPT on use of SGLT2 inhibitors in era of GLP-1 analogs. You just put it, again, different platforms try to give a different answers. Same way, if you ask probably a content, now you use a perplexity, for example, you use peer-reviewed journals, I need on use of SGLT2 in the era of GLP. Please get me the articles on it. It will kind of refine and give you a very good details. You take that content, you want to take that content and then you want to put it in Claude, or you want to put it in any of the other tools. It is left to you. I think you mix match it. You want some nice infographics, you want some nice diagrams, Gemini is there. You also have something called as Napkin AI there. It gives you good infographics there. You have the notebook LLM, which gives you good mind maps there. So it's very important to use all the tools, but in the right proportion, so that the output is more easy. But I think there are few tools there where if you get a very good prompt, you do get a very good PPT also. But it's all about your time. It's all about where you want to present, and you want to know what is the quality of presentation you want to do. You also have this, for the medical students, we have this Robin MD. I think if you log in there, I'll show you a prompt. Robin MD is there. It makes your job a little easier. So obviously by a third platform there. But Robin MD, you log in there. already there are set prompts. What is your topic? What is your target audience? What is your this thing? You put it. It gives very good medical slides. So it's already the content is from your peer-reviewed journals. So your content you're more or less sure. You copy the text. You want to put it in Claude and then download it as a PPT format. Your job becomes slightly easier. So this is a very good tool which is there. You can obviously use the same thing in Notebook LLM. Notebook LM has options of slide deck, mind map. Only problem with doing the slides with Notebook LM, some may like it. Maybe the school going presentations would be good. In the sense, it kind of gets too gaudy, and I'll show you some of the examples. So, if you want to have a formal presentation, I think Claude is a very good agent. Notebook, probably you want to for children, schools, notes. It's a very good thing in terms of the visualization. But that also you can still prompt and refine it. You can take that PPT and you can still do the mix match what is required there. But I think what I liked about Robin MD is whatever the topic is, it kind of refines things very easy. So the content is quite good, and obviously if you already have a folder of very good review articles and you are feeding it and you get the content, if you don't have the time to do that, then probably Robin MD kind of picks up. It hallucinates less. You'll get more precise information than with proper citations and references as compared to any other platforms there. So try to use everything. As I mentioned already, use the if you have the Notebook LM, you can upload all your PDFs, RCTs, the ADA, ESG guidelines, your own case series. Ask it to summarize it well. Take the summary, put it in the Claude and get the PPT. So Claude is something which is really good, provided you have your tokens or you have the subscription. It is something which will give you in a very good PPT format. ChatGPT is again useful for to have a good prompts there, but the thing is you cannot be generic. It can hallucinate, so you need to verify the citation and sources, so you need to be slightly careful there. Gemini Pro, the paid versions also have a very good issues, but one problem with Gemini sometimes can be the images. You would be talking about SGLT2 inhibitors, you would be talking about aortic dissection photo would be there. So you need to be very careful when you cannot random. It looks attractive, the slides are good, but just you need to sit and refine that. But again, you can again fine tune in the prompts and all that. Again, if you ask the question that are you accurate, it will take us for a ride sometimes. So that is something which we need to be careful when you're using this. But at the end, like everybody tells, you're the human in the loop. So you should do your basics proper. So you should be having the subject knowledge and the review of it. You should have done that so that you know which is right, which is wrong, and you can do the final corrections there. These are some of the sample prompts. I think prompt engineering and the prompt itself is an art. So each one is good in giving a different prompts. So whether you want to use, I think these are some things which you people will maybe for notebook you think of from these three uploaded RCTs. This is what I want. But I think a good prompt solves most of the problems for most of the, especially if you take some of the platforms like a Claude. A very good prompt. I'm so and so an expert. Kindly prepare me and this thing from peer-reviewed journals. 20-deck slide. My target audience is this. You can beautifully put it there, and if a good prompts almost solves most of the problems, provided you have and add on if you feed in some right sources of your PDFs and journals, the job becomes definitely easier. So to summarize, I think I'll show more in the demo rather than the regular PPT. AI tools accelerate slide building. They don't replace clinical judgment or citation checking. Use each tool for its strength. Research, as I said, Notebook LM, narrative, ChatGPT. You want to build something, Claude is good. Perplexity is very good for, again, a good review of literature. Visuals, Gemini, as well as even Notebook LM there. You have the other Gamma AI also. So you can put all the content and put in Gamma, though the paid versions are required. You get some again, depends which style of PPTs you require. Design consistency and evidence traceability are what makes a medical deck impactful and not animation. Always do a final human pass, accuracy, compliance, and patient safety, and these are non-negotiable. Let's show you a few demos before I close my part of it. So we'll take, I'll go back to the same topic. So I gave this prompt. I would be presenting a talk as an expert on the use of SGLT2 inhibitors in the era of GLP-1 RA for type 2 diabetes for the upcoming RSSDI conference in Namma Bengaluru. So it's like a second marketing which I'm doing now. So kindly prepare a 20 slide deck including references from peer-reviewed journals and up-to-date references. So it kind of gave everything. I got the PPT. Actually, I had actually made some other PPT. I was sitting and doing this now because I was able to point out some mistakes here. see it here? Okay, sorry. Yeah. So you cannot expand this. Sir. Yeah, I'll just play the slides here. So evolving landscape and all this treatment paradigm. So all the historical focus and all is good. Now you see this. The problem starts with the images. Now you have the GLP receptor agonist. You have some random image there. And this is what I was talking. SGLT2 inhibitors, you are having aortic dissection and it's showing nephrons. So it is talking. This is a PDF, but anyways, I'll just see if I can show it. That will be better. Yes. So this is what. You can see the images there. So though the content is there, the biggest problem, yes, this is quite good. Glucagon dynamics, because we know that SGLT2 can bring up the glucagon levels, GLP brings it down. The content is fine, but the biggest challenge is the images. So you need to be careful, and sometimes citations may not be there. So again, depends again on the content you have put there. So what is the evidence? So this is quite good. So what all synergistic effect has. All these factors are quite good with this one. Now you can see that cardio-renal outcomes. You have some civilization photos of some random pancreas and everything. So these are the main problem when you do like this is the photographs there. And mechanistically, it is given some random formula for glomerular pressure. So you need to be a little careful. So when you are going blindly, you believe this. But at the back end, now I've done the same thing with the Claude. So I'll just show it here. But before I got into Claude, I'll just show you. I got this content from. This is what I was talking about, the Robin MD. So medical slides. Use of SGLT2 era in the type 2 DM, internal medicine. This is my target audience. I need 20 slides. And I'll put the same prompt here. In the sense, and again the best part of this is I like this was you have this option of start with a case, end with a quiz, and then you ask. So basically, I took the content here. You can see there. This is now it has a case presentation. It has everything there. You have a proper flow. So that is done everything. Now what you can do is you can copy this content. Now I put this in. See, Claude itself will give you a good this thing. But I pasted this and then I got the slide. And you can see the slide quality here. Excellent. I'll just show you. I downloaded. You can just see the quality of PPT. Full screen. Yes. So I use the prompt. You can directly get into Claude and give you the prompt, or you can take it from Robin MD. But see the quality of slides here. The opening itself is superb. It gives not rivals but partners. Why SGLT2 remains a foundational cardiorenal protection and cost-effective therapy alongside incretin-based agents. It kind of gives you it sets the tone well. And again, though it is a very nice one. I mean, depends. And I was happy. There was a study. The INDIAP was also quoted there, and the citation is proper. Organ pathways. So across, I mean, dual mechanism. It spoke about weight loss. It spoke about glucagon. All that. So you can see the difference from the first slide. What you saw from Gemini, and now you have something. Obviously, you refine and put it, you get much better outputs, and excellent. This is. It kind of covers everything in those 20 slides, and everything. So when compared to the first one, I think definitely this was match the agent to the dominant phenotype. If CKD, HF, think of SGLT2, obesity, ACVD, think of this one. So it's almost the 20 slides, every slide made sense. And in summary, you can see here, the SGLT2 is not eclipse, it is essential, beautifully summarized, and obviously some references are also there. So definitely when you compare, uh, which was better, the first one or the second one? So you have, I mean, the basic take-home message, or what, and I have we cannot forget without showing the gaudy one. This is the notebook LM. So you can see this. Use of is the same thing which I've shown, the same prompts. It looks nice. Some people like it this way. Yeah, but I prefer the second one. But maybe you want to take some images of this, you want to put this, mix match it. That is your style, whichever way you want to do it. But it shows this. Target, glucagon. This looks nice for the ads, but you can see this some mechanism, some image. Even some there is some advantage with this also.
Yeah. So,
Correct. So you can still play. I'm not saying I'm just gone with the same prompt. Obviously, you can still fine tune it what you want, but the take home messages depends where you want to.
so that's what we should do is we should generate the text first, only text. You should give a clear prompt that you should not generate any images.
Right.
And after that, slide by slide, you can generate image.
Okay.
And with a relevant medical reference. We
So
can
you
write
just
something
the
like that.
text as a PPT format, as just with the text,
Just with the text.
and then you again feed that.
Feed that and then tell them to generate images in an individual file and then you match it. This is the one way of doing it. Because why I am saying is I am not very favoring Google, but I have been using it so much in the past few years. I try to understand it and get it. And another thing is you give a feedback with this. 2-3 times you give a feedback, but you have been wrong. You have to get it right. Means next generation when you are doing it next notebooks, it gets much better.
So that happens even clear it from the expert.
No, not an expert. Student. First of all, am I audible? All your presentations were fantastic, but one mistake. See, generic AIs will create a lot of nonsense. When you ask Claude GPT and all to make slides, they create a lot of errors. And you have to literally sit and read, and the references that you showed, I can tell you many of those references do not exist. So you will be showing wrong things when you go on an international or a national conference. That creates a problem. That the reason is these tools were not designed for a specific purpose. So if you ask an MBBS student to do a surgery, it will botch up because he's not trained. So when you're asking a generic tool to create slides, like what you all are doing is you're just giving prepare slides for 20 slides on so and so topic. It will put in a lot of garbage inside because the data that it collects is from the entire population. So what you have to do is you have to be very specific. You have to say, do not collect data outside PubMed and Google Scholar for the last 3 years. That is one thing. Second thing, see, generic AI, always treat AI as an intelligent, sentient human being. So the moment you say that you are the top 10 endocrinologists of the country and have to give a presentation at the endocrinology conference, in the same slide, presentation would change drastically. So that one word, one line makes a huge difference. So what I do is I don't use these things to prepare slides at all because they are not designed for preparing slides. They are meant for time pass. As far as slides are concerned, I mean, they're just for your self-review. So what I do even better than that is I pull up 20-25 papers on which classically you would make slides. I pull them up myself, and for that you can use AI. You can use Consensus or any other LS site or some site. Pull up those last 10, 12 relevant papers. So you can ask certain questions like, for example, suppose you're preparing a slide on how does HbA1c hold its game over TIR in 2026. So that's a good topic. But then it will be very difficult to read the literature and pull out papers. When you ask this question to Perplexity or Claude, or I will go to Consensus because that is better for that. I will get the last 15 papers which are absolutely relevant. Then I sit and write a detailed 2-page prompt to ChatGPT or Claude because their logistic power is good. Go through these papers, extract the relevant information and give it to me, create a single paper out of it. Having created that paper, then I go to a PowerPoint creator tool like Robin MD or Gamma or something which are specialized in PowerPoint. And once you put in that paper, the slides that come out are amazing. And then the content I asked them to create by telling them you're the top 10 endocrinologists. Now what happens when I'm designing a slide for Dr. Jugal Kishore Sharma, like he said, I tell this thing, please go through the last 10 years data of Dr. Jugal Kishore Sharma from the net, understand his personality because you are Jugal Kishore Sharma. Then the slides are very different. When I prepare slides for, I won't take names here because he announces it otherwise. Suppose I'm preparing the slides for a Padma Shri endocrinologist. I mean, I can't be, and I have prepared for international platforms for him. So when you prepare slides, I tell them that you are so and so. Please go through the personality of the last 10 years, update your academic status to that level, and you're going to give a presentation in ADA. Having done that, let me know if you're comfortable, I will tell you the matter. Then the matter that it pulls up are mind-boggling. You can't even imagine what matter comes out. And then when you make slides, the slides are of a very different standard. Now the last thing what you said is a cumbersome method. That you prepare the text and then you ask them to create images and match. No. You just put in a simple prompt, give me the topmost images. Now there you have to have some knowledge, whether you want to use DALL-E or Google Nano, Banana Nano or whatever, Banana Nano Pro. So you choose a right this thing according to the topic. So do you want, suppose I'm giving on thin fat Indians, do I want a graphics with a human being or do I want images or do I want photographs? So based on that you choose the right image building tool in those slide thing, and having done that it creates such mind-boggling images which are very different. Now having created this kind of a raw material, when you go to Gemini you get a different slide set, you go to Gamma you get another one, Robin MD you get another one, your Beautiful AI you get another one, Dectopus you get another one. So I create in some 7 platforms and it works better if you have a subscription. And having collected all that, then when you mix and match, the presentations are out of this world.
So I think rightly agreed by Alok sir, but I think that one of the things which mainly to show here I kind of spoke on, but general thing when this was my Diabetes India topic, and in fact before working on it, almost the entire review of literature like sir told, that was first done, drug holiday. So when you obviously have a comprehensive slide, I mean little more, I have a drive which has on each topic, so already I do my preparation there. And obviously when you do it, you need to have a mix match. You cannot kind of, and once you do it, the quality is much better, the hallucination is less. So and again it's a topic where you talk about when you can stop the incretin therapies, so you don't have images here and there. You kind of, I have mixed it up, I had few slides here and there, but at least the hallucination, I mean, since you feed the papers, kind of what you get is much better. So some of these are from the papers. So but what is important at the end of the day is don't forget the basic rule book. And as sir already mentioned, it's important you kind of feed it well, make sure the hallucination is less, and depending which tool is suitable. And I think the other important thing is everybody doesn't have subscription. So a budget way of doing it and the pro way of doing it, kind of you can mix it up.
There's an Indian jugaad for the budget. Those who don't want to buy, every tool gives you 10 slides.
Right.
So once you get the material from, your material is ready, split it into 10 papers, right? And make 10 slides per paper. And then take it at PowerPoint and join it very simply.
Thank you. Thank you once again.